Good evening to one and all, and thank you for joining us in what we hope will be an interesting and interactive session where we discuss the teaching of biochemistry CBME curriculum decoded. My name is Dr. Sudha Ganesan, Managing Consultant, Medical Publishing, Universities Press, and it is my pleasure to introduce this evening's subject and the panelists. As you are all aware, the MCI has published the long-awaited CBME guidelines for the MBBS course, with a shift in the way biochemistry should be approached and taught. This has thrown up a lot of questions in all areas, right from decoding the syllabus, devising the lesson plans, to implementing the assessment patterns. To answer these questions in these areas, we have with us Dr. Rafi, Dean and Medical Director at Surabhi Institute of Medical Sciences, Siddipet, Telangana State, who will be moderating the session. Joining him on the panel are Dr. Anita Chalak, Professor and Head of Department of Biochemistry, SET GSMC and KEM Hospital from Mumbai, and Dr. Somnath Salgar, Associate Professor and Head of Department of Biochemistry, BJ Government Medical College and Sassoon General Hospital from Pune. I extend a very warm welcome to all panelists. Before I hand over the session to Dr. Rafi, I request all attendees and I invite them to post their questions in the Q&A box, which is open for them. And these questions will be answered at the end of the session. May I now request Dr. Rafi to please take over the academic session. Welcome, sir.
Thank you, Dr. Sudha. Good evening, all the participants. Most of them are the respected faculty of biochemistry serving in various medical colleges across the country. Very warm evening to you all, sirs and madams. First of all, I'll thank all of you for joining this webinar, which we are conducting on the teaching of biochemistry, CBME curriculum decoded. So this is the theme of this webinar, teaching of biochemistry, CBME curriculum decoded. We have chosen this topic precisely because most of the 90% of the faculty, preclinical faculty, have already trained the curriculum implementation support program, where we have extensively come across the various modalities of this newly introduced CBME syllabus, where at the end of the session, we were asked that this entire CASP program, it was conducted on general principles of CBME, covering almost all the medical subjects, but it was not subject specific. So all the faculty were requested to translate these general principles, what we have learned there, to our own subjects, to make them applicable to our own subjects. So that is the reason. So we have decided this webinar to be focusing on CBME syllabus on biochemistry, teaching of biochemistry. So that we can share some of our views of our panelists with our respected faculty of biochemistry. So it is of little help for all of us. Of course, going further with this 2020 batch. Because of this COVID pandemic situation, we're all aware that we could not implement 100% of this for 2K19 batch, because most of that was going on online sessions. So coming to the point, the This topic is we have made into 3 parts. First session will be delivered by Dr. Somnath Salgar. The topic is like the general outline of CBME in biochemistry. The first session will be general outline of CBME in biochemistry. That will be dealt by Dr. Somnath Salgar, head of the department at BJMC Medical College, Pune. Followed by the second session, which will be dealt by me, Dr. Rafi. The topic will be teaching learning methods in biochemistry, will be my topic. Teaching and learning in biochemistry will be my topic, the second topic. Followed by assessment part, assessment in biochemistry as per CBME. Assessment in biochemistry as per CBME will be delivered by Dr. Anita Chalak, professor of the department at KEM, KGS Medical College, KEM Hospital, Mumbai. Of course, followed by the usual question answer session. So the whole session is planned for 90 minutes, and roughly we all will try to complete within 20 minutes each session, maybe 2 minutes this way or that way, followed by the question answer session. So with this brief introduction, I request, so we'll start the first session, that is the general outline of CBME in biochemistry. So I request Dr. Somnath Salgar, head of the department of BJMC at Pune, to present this session. Dr. Salgar, please. Thank you.
Good evening all. The objectives of my today's session are competency-based medical education, competency-based medical education in context of biochemistry, competencies in biochemistry, horizontal and vertical integration, early clinical exposure, and ADCOM module. The medical education system is responsible for training medical graduates to participate in the healthcare of society. It is of paramount importance that medical education system must work to ensure that every graduate is competent to provide the improved quality of medical care and fulfill the health needs of the society. Traditional curriculum was teacher-centered with prime focus on acquisition of knowledge. The assessment focused mainly on the knowledge rather than skills. Also, there was deficit of soft skills pertaining to communication, attitude, doctor-patient relationship, ethics, and professionalism. Yes. Next. Hopefully. Competency-based medical education has been suggested to address the shortcomings of traditional curriculum. Competency refers to observable ability of health professional integrating multiple components such as knowledge, skills, values, and attitudes. Since competency-based medical education is centered on addressing the health system needs of the society, it offers a rational approach to ensure development of competent graduates. This would effectively reinforce social accountability of medical education system to meet health needs of the population. Competency-based medical education is an outcome-based approach to the design, implementation, assessment, and evaluation of medical education program using an organizing framework of competencies. In competency-based medical education, the competencies are predetermined based on the health needs of the society. That is, the outcomes of training are identified based on societal needs. The medical graduate must attain the defined competencies by the end of the curriculum. The teaching, learning, and assessment methods in competency-based medical education are predominantly skill-based rather than being knowledge-based. Integration of various subjects to attain a particular competency is a key component of competency-based medical education. The defined roles of Indian medical graduate are that of a clinician, a leader, a communicator, a lifelong learner, and a professional. Thus, competency-based medical education is aimed to ensure fulfillment of all requisite roles of Indian medical graduate. You must be remembering, for this batch of 2019-20, there was a foundation course of 1 month, and then there was the individual departments teaching. Biochemistry, you already know the fundamental subject in medical curriculum. The comprehension of biochemistry is often considered to be indistinct by medical students, maybe due to complex chemical structures and intricate metabolic cycles, various pathways. Some students fail to realize importance of biochemistry in first year of curriculum and do not devote sufficient time to its learning. Experts emphasize importance of understanding the underlying principles and biochemical aspects which, if not learned, would lead to fragmented knowledge on applied clinical aspects. The knowledge of biochemistry is essential in context of disease or medical problem to facilitate their diagnosis and treatment. The restructured model of biochemistry curriculum as per competency-based medical education offers a promising approach in this regard. Inclusion of more volume of applied biochemistry and its integration with clinical science is instrumental in making biochemistry interesting and meaningful subject in the medical curriculum. Some of the competencies suggested for undergraduate medical student, that is first year MBBS in biochemistry, are summarized as: he should be able to interpret laboratory results of enzyme activities and describe clinical importance of various serum enzymes as markers of pathological conditions. For example, CKMB as cardiac marker in acute myocardial infarction. Be able to discuss the regulation, function, and integration of carbohydrate, lipid, and protein metabolism along with associated disorders. Be able to interpret results of various lab analytes associated with disorders of carbohydrate, lipid, and protein metabolism. For example, in diabetic ketoacidosis, blood glucose profile, and ketone bodies. Be able to discuss digestion, absorption, and importance of nutrients and disorders associated with nutrition like protein, energy malnutrition, and obesity. Be able to describe biochemical role of vitamins and minerals in the body and explain the manifestations of their deficiency and toxicity. For example, vitamin D deficiency as rickets and osteomalacia. Be able to describe the processes involved in the maintenance of normal pH and electrolyte balance and interpret the arterial blood gas analysis in various disorders. Describe the processes involved in replication and repair of DNA, the transcription and translation mechanisms, regulation of gene expression, and application of various molecular biology techniques in diagnosis of diseases. To be able to describe the cell-mediated and humoral components of immune system and concept of antigen-antibody reactions as basis for ELISA. Be able to describe various tumor markers and biochemical basis of cancer therapy. Be able to perform and interpret biochemical analysis of urine for inborn errors and cerebrospinal fluid. Observe the various equipments or techniques used in biochemistry laboratory, such as paper chromatography of amino acid, protein electrophoresis, thin layer chromatography, polyacrylamide gel electrophoresis, electrolyte analysis by ion selective electrode, ABG analyzer, autoanalyzer, quality control, DNA isolation from the blood or tissue. Explain the basis and rationale of biochemical tests done in following conditions like diabetes mellitus, dyslipidemia, myocardial infarction, renal failure, gout, proteinuria, nephrotic syndrome, edema, jaundice, liver diseases, pancreatitis, disorders of acid-base balance, and thyroid disorders. To be able to calculate energy content of different food items, identify food items with high and low glycemic index, and explain the importance of these in the diet. To be able to enumerate advantages and or disadvantages of use of unsaturated, saturated, and trans fats in the food. So these and other skills have been defined in curriculum under competency-based medical education. The chief new additions to the overall program are integration, early clinical exposure, self-directed learning, and special training of ethics and communication as ATCOM module. A noteworthy shift proposed under competency-based medical education is that of integration. Horizontal integration is between the three departments of first year: anatomy, physiology, and biochemistry. For example, the anatomy department will teach the anatomy of the liver, physiology department will teach the physiology of bile secretion, and biochemistry department will teach the liver function tests. Similarly, renal function tests, thyroid function tests, pancreatic function tests, then muscle metabolism, the diseases like peptic ulcer, gastroesophageal reflux disease, vomiting, adynamic ileus. Vertical integration of basic science with clinical science would ensure learning of topics with holistic approach. For instance, iron metabolism is taught as a topic in biochemistry to the students. If we integrate teaching this topic to a case of anemia, especially iron deficiency anemia in medicine, along with correlation of lab investigations, it will consolidate the overall learning in a meaningful way, shifting the focus from abstract information gathering to clinically relevant application. The change in teaching learning methods concentrating on student-centered approach would enable learning in form of problem solving rather than information gathering. This will help in building up the medical students as active learners right from inception, that is, from the first year itself. The traditional didactic lectures have their own relevance and should not be scratched off completely. However, their frequency should be decreased in the curriculum and they should be complemented along with case discussions and case scenario based studies. This will also help to grip the interest of students and to delineate importance of biochemistry in understanding the basis of various disease processes. For instance, topic on membrane structure and function relationship can be taught with the help of a clinical case on diarrhea. This would not only make the students inquisitive to learn, but also make them understand the relevance of the topic as to why they should learn about membrane structure. Then we also have few other examples in vertical integration, that sickle cell anemia, thalassemia we teach in biochemistry. Again, they have the vertical integration in pathology. Then dermatology, vitamin deficiency, various vitamin deficiency like then zinc deficiency. Ophthalmology, we share the topic of metabolism of lens. Then in general medicine, the biochemistry of atherosclerosis and medicine topic, vertical integration with the atherosclerosis, lipid profile, diabetes mellitus, various malignancies. So these are the examples of vertical integration. Then pediatrics, various vitamin deficiencies and malnutrition. Then in general surgery, homeostasis, metabolic changes in injury and their mediators. So these are all various examples of vertical integration. Early clinical exposure is also important, advocated in competency-based medical education, another step to rationally link theory of basic science to clinical practice and bridge the gap between these disciplines. It can be implemented in three basic forms. Firstly, classroom setting, wherein patient can be brought to the classroom or paper cases can be discussed. Then second is hospital setting. The visits to the wards or clinics. And thirdly, community setting. That may include primary health center or community visits. Early clinical exposure would also enable a vertical integration in the curriculum. In first year of MBBS, early clinical exposure can be implemented in any of the mentioned forms in context of biochemistry. Early clinical exposure in biochemistry should also include interpretation of various lab reports in background of clinical cases. This would enable a better understanding of clinical importance of various biochemical analytes, hormone assays, and enzyme markers. The next is the ATCOM module. The competency-based medical education emphasizes learning of ethics and communication skills in undergraduate curriculum, imbibing of soft skills pertaining to attitude, ethics, and communication during the MBBS curriculum would enable the graduates to fulfill all the roles of Indian medical graduate effectively. Then, this aims to instill the compassion in the medical graduate as a professional and enable him to discharge his duties towards the society with empathy. Thus, competency-based medical education has the potential to realign medical education to meet the societal expectations effectively. So, thank you very much. Now, I hand over the next session to the Dr. Rafi MD for the next topic, teaching learning in CBME in biochemistry. Thank you very much.
Thank you, Dr. Salgar. Thank you, Dr. Salgar. So now let us move on to the second session, that is teaching and learning in biochemistry, teaching and learning methods in biochemistry for a short duration. Teaching and learning in biochemistry as per CBME curriculum. So in fact, when this new CBME, which stands for Competency-Based Medical Education Curriculum, announced in 2K18 by the erstwhile Medical Council of India, there was some hue and cry among the faculty and other subject experts about the very need of changing the syllabus, because until that time most of us were of the opinion that yes, the curriculum is quite okay, it's going strong, and what is the exact need of making any change? So that was the feeling of most of the subject experts at that time. And most of the teachers and clinicians who are serving as faculty in medical colleges in India are not aware of the competency-based medical education system that has been operative for the past, let me say, 40 years in some of the developed nations, mostly in the European countries and US. the competency-based medical education was already in force. There were several batches which were trained under that curriculum, new curriculum. If we know the curriculum which we were teaching until 2K18 batch was in fact framed in 1997, which we call it as a traditional syllabus, which was taught for almost 1997 to 2018 admission batch. It is almost for 22 years, 22 batches, where this new syllabus, competency-based medical education, was announced in 2K18, and which is enforced from the batch that got admitted in 2K19 onwards, this COVID year. So, irrespective of that, some sort of dissent or hue and cry about the new syllabus, maybe that is because of lack of awareness among most of us about what is it meant by the competency-centered, the competency-based curriculum. Here, the competency means, of course, that technically, the competency means all of us know, it is the ability of a candidate or a learner, which is observable. It's an observable ability of the learner, that is a student, which has multiple components, like his knowledge, his skill, attitude, communication values. And of course, the first two components, that is the knowledge and the skill, was very much part of the traditional curriculum, which we have been teaching for the years together. But the last components, which are new additions, I feel. So the competency, there's the ability of an observable ability. When we study that, apply that in terms of preclinical subject, especially biochemistry, it is the experience of every teacher among us who have been teaching maybe the past 5 years, decade, 2 decades, or more than that. It is a common experience of all of us as teachers, as medical teachers, facing several questions from students about the applicability of the subject, the biochemistry, the subject of biochemistry that is taught as part of the framed syllabus. And of course, at our individual level as a teacher, we used to answer them for whatever the way we understood and whatever way we wanted to communicate, whatever way we wanted to present the subject, whatever way we want the students to learn the subject. That was happening at the individual level, or at the most at the institute level, at the department or institute level, in certain institutes. This new syllabus of CBME has given us an ample opportunity of completely restructuring our subject, biochemistry, which was earlier thought to be somewhat not exactly linked to the clinical medicine, and most of the students who are passed out, even after passing out MBBS course also, they were not sure why we studied biochemistry at all. Except certain investigations, certain clinical tests that have been done to help the clinician in his arriving at a diagnosis. Except that aspect, most of the students, most of the medical graduates are not exactly aware of the real role of biochemistry in defining the medical science itself. So that was not happening to the extent most of us wanted that to happen. I think now this new syllabus has given us a wonderful opportunity to elevate the subject of biochemistry, the very crucial position of biochemistry in understanding all other medical subjects, maybe the almost a 2 dozen of medical subjects, in understanding them in true spirit. Okay, to explain that, I'll take a few minutes explaining the table that is displayed here as a slide. Understanding the competencies table. All of you are very much aware of this table. I'll just try to focus my discussion, focusing on our subject, that is biochemistry. And of course, the first column, which has 10 columns, First column, it said, of course, that shows the unique number each competency has. Of course, let me add one sentence over here. Earlier, we were teaching the subject as, of course, various chapters, maybe various sections, like the metabolisms, the physical chemistry, the molecular biology, nutrition, and so on and so forth. So here, and of course, here the subject of biochemistry is made into 11 topics, where the 10 topics are covering the theoretical biochemistry, and the 11th topic covers the practical biochemistry at undergraduate level, where there are 65 competencies that were covering the 10 topics. So the 10 areas, the 10 broader areas were divided into 65 competencies. And of course, the practical biochemistry has 24 competencies. So coming to a total of 65 plus 24, that's 89 to 90 overall competencies. So the subject of biochemistry will be taught in 13 months of time in the given stipulated hours, covering these 90 competencies. So each one of these 89 to 90 competencies have their unique number, where the subject, next, the topic covered with a running number. That is the specific competency. The second column is the competency itself. So where, since the competency is the crux of this new syllabus, where this new syllabus itself is competency based, that means it's a student centric, because the competence itself defines the ability of the learner. The learner here is the student. So the competency centered syllabus is nothing but student centered syllabus. So the entire onus is on the student to gain knowledge, to learn the skills and perform as a medical graduate, as a clinician. So for this, I have chosen few competencies, few samples, few competencies as samples to discuss how best we can teach the biochemistry, fulfilling all the requirements that were expected of us, of a teacher, of a biochemistry teacher, from this competency table. Okay, next I'll move to the next column. And of course, moving to the next column, these competencies where we teach the core of the subject will be, of course, biochemistry, where, and of course, there are certain components of a CBME as taught by the earlier speaker, Dr. Somnath, like the early clinical exposure, the alignment aspect, the self-directed learning, maintaining a logbook, several such newer aspects which were never heard of in the older syllabus. We need to fulfill all these aspects because there is no separate it has to be dealt with the teacher, the same preclinical teachers only. The early clinical exposure, which was given 90 hours during the first preclinical course, where the 30 hours is given to us, 30 plus 30 plus 30, and not physio and biochem. So in the 30 hours, again, it is divided into 3 segments. The first segment is the basic sciences correlation. The basic sciences correlation, which is given 18 hours, where we are advised to handle 3-hour session per month into 6 months. That is coming around 18 months, 18 hours. Of course, 3-hour session is quite a long session. 3 hours is quite lengthy one. Most of us feel so. But since the component which we need to cover in this segment, that is the basic sciences correlation, which has, of course, you need to conduct that within the 4 walls of the classroom, lecture gallery, where of course you can brought the patient to the lecture gallery, or you can play a video, a comfortable video there in the lecture gallery, or else you can involve the students for a role play, or you can have any other innovative aspect, method you can use as part of this early clinical exposure, which we need to conduct for 3 hours, where the first half an hour will be introducing the subject, orienting them. Later, 1.5 hours, almost 90 minutes to the core of the subject. Later followed by, of course, the summary and the discussion, question answers, and finally giving the take-home message to the student. So that is the first component of early clinical exposure. So wherever it is required, suppose if a competency, if a teacher feels that this particular competency needs an early clinical exposure, for example, the second topic is shown as enzymes in biochemistry, which has almost 7 competencies. I think we can conduct one session of early clinical exposure for this. That is the basic sciences correlation segment of early clinical exposure can be allotted to this topic of enzymes. The choice is the teacher's choice, the HOD choice. They can choose one topic, one competency, or a couple of competencies, and make it into an early clinical exposure module of 3 hours, where you can completely summarize the whole the core of biochemistry subject. Of course, if it has a vertical or horizontal or both integrations, and of course the various other suggested teaching and learning methods, all that you can club together and have this early clinical exposure to be fulfilled in respect to this particular competency. Later, the second component of early clinical exposure, which reads like the clinical skills, imparting the clinical skills to the student, because every medical student, as soon as he joins a medical college, he imagines that he will be exposed to some component, that is the basic component of clinical skills. But in the traditional curriculum, for the first 1 year, or earlier it was almost for 18 months when we were students, except biochem, anat, and physio, the didactic, most of the lectures were didactic, interactive sessions were very less, and there was no clinical exposure at all to the student. So to just break that monotony, so this early clinical exposure, which was introduced in CBME, where we need to conduct dedicated hours are given. So so importing the clinical skills. So whose job to import the clinical skills for a preclinical student? And can we do that in the college premises, let us say in the demonstration rooms or in the lecture galleries or in the in the laboratories? I think for a part, we can do that in the skills lab, in our student laboratories, making short groups. We can do that to an extent, but mostly we need to encourage the student to enter into hospital premises where we can take the help of the clinicians of various departments as per the particular competency or the particular topic demands, and you can impart. You can always impart the clinical skills, the very basic clinical skills within the hospital. Sometimes you can take them to a community health center, which is affiliated to your institute, and you can expose them to the OP patients who are visits the community center, and the clinicians who are work there. Like for example, I'll take one simple example of if you show a thyroid case, whether in the community health center or in the hospital premises itself, in the department of surgery, where anyhow the anatomy people they will is what happened the thyroid structure, then what happens to thyroid swelling upon deglutition, and all that they will be teaching. And coming to biochemistry, yes, there is a lot a lot of clinical interpretation aspect. We can teach the student showing the case of a thyroid, real case of thyroid in the hospital premises, covering little and not little physio, and the entire biochemistry aspect, whatever we want the student to learn. A thyroid case is related to. So when we show a case there and discuss the, let us say, surgery or medicine, whatever related to that, and of course little anatomy and physio, and teaching the biochemistry by the biochemistry professor teacher in the hospital premises, preferably in small groups, so that gives them a confidence of how a thyroid case can be dealt with. Mostly we will be teaching the diagnostic aspect, because that's the practical aspect. Theory, of course, that can be dealt as a didactic or interactive lecture as the regular teaching, as part of regular teaching, but the diagnostic aspect has to be taught as a clinical skill, because the clinical interpretation, the diagnostic interpretation, it also is a clinical skill. The student has to learn. So that creates some sort of interest for the student when he comes back to the lecture gallery for the regular learning. When he learns the biochemical perspective of endocrines, the thyroid here, in this case, by the time he knows how a case looks like, what's the clinical presentation of the case, and how to examine the case physically, and how to obtain a history over there, and how the subject of biochemistry as a diagnostic science is helping the clinician in arriving at a proper diagnosis. So he has that as part of the early clinical exposure. He has that preliminary knowledge where he is already exposed to. So that makes his job easier, makes our job very easier and very interesting when he comes to the actually learning a particular topic. Right. So the next, let me, of course, I don't go into most of the details of course, I have several slides to show on, but most of the time I'll be spending on this only. Because let me explain this, and coming to the third one, that is the domain part. Of course, the knowledge, skill, attitude, and the communication, followed by the next slide, next component, that is the level of competency, where the student should know or knows how, and he will shows and will be able to show how, and of course finally able to perform something, a skill independently. So this is the next component. And coming to the biochemistry subject, where the slides which follow, most of the slides are showing K or KH only. And coming to the core, most of this is core. Most of the subject is core. Non-core is only one topic. And teaching, and of course the suggested assessment method, that will be dealt with Dr. Anita, the followed session that follows. Next, certifications. The certifications is almost not required at all as far as theoretical biochemistry is concerned. Only there are few certifications, 5 I think, that are required in the practical biochemistry. Then coming to the integration part, the vertical and horizontal integrations. So next slide, please. Yes. So here there is a series of few slides. Of course, I'll be covering maybe 2 or 3 slides because I want to show them as samples. For example, here the enzymes. The topic of enzymes, they describe and discuss the clinical utility of various serum enzymes as markers of pathological conditions. This is a competency. This is a competency in the topic of enzymes, which has an integration with a vertical integration with pathology and general medicine. Fine. Okay. So when we teach this particular competency, of course, as a biochemistry teacher, we know everything what we need to teach. What we need to teach for this particular subject topic. Almost 80% of our lecture will be biochemistry only. When coming to the integration part, the pathology and general medicine, which is a part of vertical integration, I'll take the example of this one competency only, since the time is running out. Where when we discuss about the clinical utility of various serum enzymes, of course, there are multiple enzymes. For example, we take the aminotransferases, ALT and AST. So the ALT levels are elevated. We say, after telling everything about ALT, this biochemical role and all, we tell there's clinical applicability, where we show like the liver disease that are elevated, like the infective hepatitis, parenchymal liver disease. Almost every student, every preclinical student is not aware of these clinical terms, where it is the job of us to integrate, to explain these clinical terms here, like what does it mean by ineffective hepatitis, what does it mean by parenchymal liver disease, and what is the biochemical basis, what is the biochemical mechanism, what is the molecular mechanism underlying the elevated levels of these aminotransferase enzymes in these diseases. So I think most of the competencies, wherever there is an integration, wherever there is no integration also, as a teacher, introduce all the clinical terms which are very much newer to the preclinical student in context of biochemistry in a very simpler terms, and connect them, link them, bridge them to the whatever alteration or whatever change, deviation that happens from the normal internal milieu to the abnormal one. Link up that biochemical mechanism to the clinical manifestation. So that is the real challenge, and that is the crux of this new CBME syllabus. So what I feel. Of course, I request the one to just slide over the remaining slides at a faster pace, maybe a few seconds. This is about Krebs cycle. Next. Yes, this is about carbohydrate. That's the regulation of glucose, homeostasis of glucose levels. Next. Of course, this is about the lipoprotein metabolism and its relation to cardiovascular disease. Next. This is about the structural organization of proteins and of amino acids. Next. About the role of vitamins. Of course, this is only one competence that is given to the huge topic of vitamins. Next. Yes, this is about the biological oxidation, the energy generation path. Yes, so with this slide, I conclude my lecture. The bottom line is, as a teacher of biochemistry, apart from teaching the core biochemistry, wherever there is integration, whether it is horizontal or vertical, and wherever there is no integration also, we need to introduce all those new terms, all those new clinical terms in context of biochemistry, so that the underlying biochemical mechanisms can be easily understood by the student. So this is the final word I would like to convey. So with this, I conclude this teaching and learning of biochemistry as per new CBME syllabus. Now I request the third panelist, Dr. Anita, to take up the topic of assessment, which most of you are very much interested to, because we are not exposed to the assessment part so far, because most of the colleges, they haven't conducted the first MBBS examination. So Dr. Anita will discuss in detail the various modalities of assessments, theory, practical, formative, summative, everything she will discuss. So now I request Dr. Anita to take over.
Hello. I hope I'm audible.
Yes, you are audible.
So a very good evening to each one of you. After having wonderful sessions on general principles of competency-based medical education and teaching and learning in competency-based medical education, let's have a look on principles of assessment in competency-based medical education in general as well as in context with biochemistry. Almost all the medical colleges have done with their teaching, done with the CISP training before the teaching started, and almost done with the teaching as well as with the internal assessment. And we are waiting for the summative assessment to be declared by the universities, and we are waiting to conduct those. So I will be talking on competency-based assessment. Whatever ways we have been teaching this year, throughout the year, the assessment which we are conducting throughout the year are were a little compromised way, as all this we took in an online form. So, I think next slide. Finding difficulty to change the slide. Okay, let me see.
Just click on that slide.
Next. Yeah. The objectives of my session are to understand the role and place of competency-based assessment in the new competency-based curriculum, to understand the role, to understand the differences between the traditional assessment and the competency-based assessment, to appreciate the changes in the assessment proposed by GMER, to align assessment with competencies in context with biochemistry, to learn the opportunities for assessment, and to enable the faculty to plan effective assessment for competency-based assessment. So let us revise the definition of competency-based medical education before we go into assessment part. Competency-based education has been defined as an outcome-based approach to the design, implementation, assessment, and evaluation of a medical education program using an organized framework of competencies. So it's an outcome-based approach and it uses the framework of competencies. Let us have a quick check on the features of competency-based assessment. Assessment tools should align with the competencies and objectives. As discussed by Dr. Rafi, we will also see some of the examples in how we can align the assessment tool with the competency or the objective in context with biochemistry. Competency-based assessment is a continuous and ongoing process with opportunities for providing developmental feedback. This will help the teacher find the stage of the learner, need for further intervention and better learning. Direct observation has been given stress in this competency-based assessment, and it improves the utility of competency-based assessment and feedback. And feedback further helps learner improvise and achieve the competencies. Competency-based assessment should help students to acquire competencies, and this is called as assessment for learning, and also for their certification, which is called as assessment of learning. Now, internal assessment is used to provide feedback and hence improvise learning. So it is used as or used for assessment for learning, while summative assessment, also called as university examination, is used to certify, to make a decision on pass or fail. So it is assessment of learning. There are certain fixed criteria given in competency-based assessment for eligibility for certification. So it is a criteria referenced. Now you can see this ballet dancer. Now she is very skilled in dancing, but it is not necessary that a ballet dancer who is so skilled in dancing will also have the skill to climb a mountain, as shown in the another figure. Similarly, a student who is good in psychomotor skills like performing some experiments or some procedures on the patients may not necessarily be good in cognitive skills or soft skills like communication skill, teamwork, etc. So there is a need that all competencies be assessed multiple times and different ways. Single summative exam or the end of year examination is not suited to this purpose. Moreover, to improve the validity and reliability of competency-based assessment, multiple assessor, multiple tools, and multiple assessments are required. Now, the purpose of assessment in competency-based curriculum. The important purpose, one of the important purposes is to help the teachers decide whether students have acquired the desired competencies. And this is usually done in the summative assessment. It can be achieved by summative assessment, also sometimes can be achieved by internal assessments. An equally important purpose is to help students acquire and improve their competencies. And this can be achieved mainly by internal assessment, day-to-day feedback which we give, which we provide in the internal assessment. It helps improve the learning and acquire the competencies by the learners. Now, certain competencies like soft skills, like communication skills, teamwork, ethics, professionalism, and even the procedural skills, they are not accessible at term and examinations. So here comes the role of internal assessments. Now let us see how does competency-based assessment differ from traditional assessment. Traditional assessments are easy to design, administer, score, and analyze compared to competency-based assessment, but it may not be able to provide complete information about the level of the student, which is actually done by competency-based assessment. So traditional assessment are snapshot observations of learning and are generally not linked to the outcomes. CBA, on the other hand, provides more comprehensive information, not only about the current level of the student, but also about his progression and ascendancy. And it also helps in generation of authentic feedback, which helps students to learn better. Now, we should keep in mind that for undergraduate students, the assessment would be chiefly for the shows level, up to the shows level as per the Miller's pyramid. Since they are not authorized to independently take care of the patient or are not directly in charge of the patient care, targeting the DOES level, which is the highest level of Miller's pyramid, will definitely pose some logistic difficulties and will not make any sense. So we should keep in mind it should be up to the shows level. Record keeping is an integral part of competency-based assessment as it helps the students, teachers, as well as the administrators to understand the learning trajectory as well as enable them to take corrective actions. Now we are ready with the competencies. I mean, we have already been provided with the competencies. They are there in the curriculum document. So we have already done in the subject of biochemistry, or we can say in preclinical phase, competencies has already been converted to objectives. And we all know that a single competency may have multiple objectives. So that is the first task. Competencies are converted to objectives. Once the objectives are ready, we try to link it with teaching learning methods and the assessment methods. Now, depending on the nature of the objective, we decide on the teaching learning method and we decide on the assessment method. Like, for example, if the objective is to the student should be able to perform some task, maybe perform some procedure on the patient, or maybe if I take it in context with biochemistry, if she should be the student should be able to perform the test on glucose in the urine sample of a patient. So this is the objective. Now, the better teaching learning method can be DOAP can be used. It cannot be taught in a didactic lecture. Similarly, the best assessment method for this will be OSPI, as it cannot be assessed in the theory in the form of LAQ or SAQ. We cannot ask his performance in the theory. So this way, this is what is called as aligning the objectives or competencies with teaching learning methods and appropriate assessment methods. Now, one more example I take, this is BI, which is the code for biochemistry. This is competency number 11.4, and the competency reads as perform urine analysis to estimate and determine normal and abnormal constituents. So this competency has around 12 to 15 objectives. For the convenience, I have taken 2, and I will just focus, taken 4, but I will just focus on 2 of these, just for the purpose of understanding. So the first objective is describe the procedure for collection of random and 24-hour urine sample correctly. So here what we are assessing, the domain is knowledge. We are assessing the knowledge of the student, and it is up to knows how level, and it can be better taught in lecture or small group discussion. And the best assessment method can be in the form of, it can be asked, the procedure can be asked in LAQ, SAQ, it is best assessed. Now, if I take this third objective, demonstrate the steps of measuring specific gravity using so and so. So here the student is expected to demonstrate the step. So what we are assessing here is skill. We are assessing the skills of the student, and the level is up to shows how. He will show how he is measuring the specific gravity. And the best teaching learning method can be DOAP, that is demonstration, observation, assistance, and performance. And it can be best assessed by OSPI. It can also be assessed in experiments during practicals, and a few questions. The knowledge component of it can be assessed in Viva, but the best assessment method would be OSPI. Now, coming to assessment, as we all know, it is a systematic process of documenting and using empirical data on the knowledge, skills, attitudes, and beliefs to refine programs and improve student learning. Now, the key to success of CBME is the alignment between competencies, teaching learning methods, and assessment. So in the previous slides, I have explained how competencies or the objectives can be aligned with the appropriate teaching learning methods and the assessment methods. Now, what are the opportunities for assessment? What are the ways by which we can assess our students? Summative assessment, we are very well aware of it. It is also called as university examination. It is an assessment conducted at the end of instruction to check how much the student has learned. So it is used to certify. It is used to make a decision on pass or fail. Formative assessment is an assessment conducted during the instruction, which means during the lecture, during the seminar, during any activity, during the practical, and its primary purpose is to provide feedback. So we can provide the feedback to the student there itself, which will help in improving the learning. Internal assessments are the range of assessments conducted by teachers teaching a particular subject with the purpose of knowing what is learned and how it is learned. So this internal assessment solves the purpose of both formative as well as summative assessment. Now, focusing on internal assessment, how it should be based on day-to-day assessments. Record books and journals and the logbooks can be used. We can ask the student to note down the daily activities in the logbook, and we can assess that way. We can use seminars, assignment, clinical case discussions, problem-solving exercises. During these activities, we can improvise on their learning. We can provide them the feedback and improvise on their learning. Regular periodic examination should be there. And the criteria is at least 50% marks, combined theory and practical, are required in order to be declared successful at the final university examination. it should reflect as a separate heading at the summative examination. Remember that it should not be clubbed in the summative exam. It should be a separate head. And if a candidate has not secured the requisite aggregate in internal assessment, he may be provisionally permitted to appear for university examination. However, he or she has to successfully complete the remediation measure prescribed by the respective institution or university prior to the declaration of the result in that particular phase. Failure to meet prescribed 50% marks in internal assessment, even after availing the remedial measures, will lead to the annulment of the results in that particular subject in the university examination. Now, the components of internal assessment, these are the tools like written theory can have written tests, can ask for reflections, practicals, can be done by the experiments, internal assessment can be done by experiments, OSPE, DOPS, that is directly observed procedural skills, record maintenance in the form of logbook and journals. Assessment of logbook, activities like seminars, quizzes, symposia, even some certifiable competencies can be assessed through logbook. EdCom, as we know, there is a compulsory short note in the theory paper, which comes in paper 1 on EdCom. So it can be assessed in theory, as well as we can ask them to have some creative writing experiences. It can also be assessed by OSPE. So these are the tools of internal assessment. Now let us see in biochemistry. In biochemistry, the internal assessment, there are 3 internal assessment. Internal assessment first and second internal assessment. These are replica of each other, and each internal assessment consists of 100-mark theory paper and 50 marks for practicals. While the third internal assessment is also called as preliminary exam, it has 2 theory papers of 100 marks each. So total theory is for 200 marks and the practical is for 100 marks. Now, the eligibility criteria to appear for the university examination is 50% combined in theory and practical, not less than 40% in each separately. So this is the eligibility criteria for appearing for the university examination. Now here I repeat, internal assessment marks are not to be added in the marks of the university examination and be shown separately. Now coming to summative assessment. Now the purpose of this is to know whether the candidate has acquired the necessary knowledge, minimal level of skills, ethical and professional values with clear concepts of the fundamentals which are necessary for him to function effectively and appropriately as a physician of first contact. The components of theory paper are, it can be in the form of LAQ, questions can be in the form of SAQ, can be in the form of brief answer questions and MCQs. But remember that MCQ should not account for more than 20% of the total theory marks. It depends on your university, what pattern they have given. Now, practical, the purpose is to assess proficiency and skills to conduct experiments, interpret the laboratory data, and form logical conclusions. Viva or oral examination will assess the knowledge, even it will assess the attitudinal skills, the ethical and the professional values. There shall be only one summative examination in an academic year and a supplementary examination to be held not later than 90 days after the declaration of the results of the main examination for those who couldn't make in the main examination. So as I said, there are 2 theory papers of 200 marks each in the summative. So it is a replica of preliminary examination, 2 theory papers for 100 marks each and practical is for 100 marks. And the passing criteria is mandatory 50% marks in theory as well as in practical. And now this is the change made in CBME. Earlier, the Viva marks used to get added in theory, but now the Viva marks are to be added in the practical marks. Now, this is remedial internal assessment. This is for the students who are not eligible and it is to be conducted before the supplementary examination, and it is the same as that of the preliminary examination. Even the eligibility criteria is same. Now, this is the question paper pattern in biochemistry as per the Maharashtra University of Health Sciences. So this is paper 1 of biochemistry having 100 marks. The total time is 3 hours. It has 2 parts, section A and section B. Section A consists of MCQs. So there are 20 MCQs for 1 mark each. Now, out of these 20 MCQs, 4 MCQs should be clinical application based. While section B consists of 3 types of questions: brief answer questions, short answer questions, and long answer questions. Brief answer questions, the student is supposed to solve 10 out of 11 and each question is of 2 marks. While short answer question, there are 8 out of 9 and each question is for 5 marks and one question is compulsorily from the 8com, and for biochemistry it is 1.4 module, 8com module 1.4 is there for biochemistry. Long answer question, there are 3 long answer questions out of which student has to write 2 and each long question is for 10 marks. Now this pattern may vary for different universities. This just for the purpose of showing, and just a sample which I'm showing, which is given by our university in Maharashtra. Now this is the practical pattern in biochemistry, again given by Maharashtra University of Health Sciences. Now, the first question is same quantitative estimation, but the change made here in competency-based assessment, or you can say competency-based medical education here is, earlier we used to ask straightforward question like estimate the creatinine levels in the given serum sample, but now it is case-based. So we give a case scenario, a clinical case scenario to the first MBBS students, and we ask them to estimate the appropriate parameters in the given urine sample. Now this as we do for MD biochemistry, but again the difficulty level of the case will definitely be lower as compared to the MD biochemistry examination. Second question is same as urine report. Again here you can have a case scenario and we can ask the student what abnormal constants he can find out in the urine, or it can be against you can ask a quantitative estimation also, a short quantitative estimation as a B part of this. Now this is a new addition as per CBME, that is quality control, and here we just want to give our undergraduate students a basic idea of maintaining quality in the clinical laboratory, where basically we can ask them to very simple things like ask them to calculate mean, standard deviation. Now this year, because of COVID, we could not conduct their regular practicals, but we can go a little higher and we can ask them about errors, and we can ask them about the Westgard rules and other things also. Now, another component which has been newly added in the practical of biochemistry is interpretation of the laboratory reports. So we can put some laboratory reports and we can ask the students to interpret that laboratory reports, or we can ask a few more questions on that. Again, there is another thing which has been added is special technique, and clinical based questions on those special techniques can be asked. So this is for 20 marks. Spots are as usual. Earlier also it was there. So it makes a practical of 80 marks. And Viva is for 20 marks, for 10 marks for each paper. So it makes up to 100. So practical is for 100 marks. So again, I'm saying this is the pattern given by MUHS. Your university may give different pattern, but the marks remains the same. For the university examination, 200 marks for theory, 2 papers for 100 marks each, and 100 marks for practical. And Viva marks are to be added in the practicals and not in the theory. That should remain the same. So to summarize, competency-based assessment operates within the framework of competencies. Assessment tools should align with the competencies or the objectives. The internal assessment is assessment for learning. University examination, that is summative assessment, is the assessment of learning and provides certification, making decision in pass and fail. Competency-based assessment is a continuous and ongoing process on day-to-day basis with the help of logbooks, journals. We can provide them the feedback. So we have the opportunity for providing feedback. And of course, we can improve the validity and reliability of competency-based assessment by having multiple assessors, multiple tools, and multiple assessments. I think that is all for me. Thank you very much. These are the references I used: the curriculum document of NMC, the MCI document, our university, MUHS, and a document on SLO, which was made by me and my colleagues. Thank you very much. Questions are invited.
Thank you all panelists. It was an excellent presentation. As we wait, I encourage the attendees, if you have any questions, to kindly post them in the Q&A box. But while we wait for that to happen, I would just like to draw the attendees' attention to what is on screen. We do have two books, textbook of biochemistry and Manual of Practical Biochemistry, both by Dr. Rafi. And if you see on screen, there are QR codes for about 3 ways in which you can purchase these books. We invite you to go enter our website, have a look at the books, and have a look at what is available from Universities Press. It is yes, and if you have any feedback, we would definitely value your feedback regarding any aspect of the book or any aspect about the subject or the webinar at info@universitiespress.com. Now, can I just go on and ask you a couple of questions from my side, the panelists, Dr. Rafi, because one of the things I would like to know is, most faculty are wondering, how do you actually conduct a small group discussion when you have a class of, say, 200 people with you? And the second thing which would be interesting for attendees to know is, what are the innovative methods you have used over the past year to teach the students? Perhaps you could elaborate on this. We have about 10 minutes for the Q&A session as we wait for Dr. Rafi, would you like to take any of these questions? Yes.
In fact, that's a very tough question, because yes, as per the new CBME syllabus, the NMC wants, in fact, reduce the old didactic sessions, didactic lectures, to almost 1/3 as that of earlier. That means the remaining 2/3 have to be done in various other modalities of teaching. That is, whether it's a small group teaching, or whether it is into DOIP sessions, or other early clinical exposure, that is again to small group sessions, which the very precondition, the very basic requirement to conduct the small group sessions is having more number of faculty and a department. So unfortunately, the MC has reduced the number of faculty also. So, I mean, whatever the faculty that is available in most of the medical colleges right now is very difficult for the department to divide the students into multiple groups, of course. But finally, we have to take it as a challenge. And the permitted level of small group is 25 students for each group. That means a college having running with a 150 intake, I think they can make them into 6 groups. I think most of the colleges have the 6, including the HOD, the faculty members. I think so. There is, and of course, coming to the space, there are many spaces like the demo rooms, level up, lecture galleries are there. I mean, the laboratories are there. So the space, there's no space constraint in most of the colleges, but it is definitely the number of faculty that are available.
Need of the hour.
We need to somehow adjust that.
I understand.
Yes, we cannot compromise on the quality of teaching. So since 2/3 of the teaching is recommended to be done in small group teachings only, because the older the didactic or the interactive session and the larger scale of 150, 200, 250 students, of course, that has to be confined only to 1/3 the regular teaching. And of course, the medical departments have their own innovative ways
of doing that. Dr. Anita, there is one question for you. Can you, from Dr. B. Pungurali, can you please explain EdCom-based assessment questions with one example? This is the demand of faculty. They want specific examples.
Yeah.
And self-directed learning as well with examples.
Yes. EdCom, basically, we deal with biochemistry subject, deal with the module number 1.4, which is basics of communication skills, wherein we will be dealing with, I mean, the questions which can be asked, like different ways of effective communication, what are the principles of communication, listening skills or the importance of listening skills in communication, verbal and non-verbal communication, the significance or the importance of non-verbal and verbal communications, body language, all these can be asked in the form of a short question. You're asking me about the assessment, I hope. So yes. Assessment in the theory can be asked in that way. While in the practicals, you can assess the students. During the Viva, you can assess you can say the attitudinal aspect you can assess during the Viva. that can be done during the Viva, like how he speaks, whether he's giving respect to the teacher or not, whether he's taking the permission to sit or not, whether he's rude. So that you can assess during the Viva. If you want, you can send me your mail ID, or you have my mail ID. I will mail you the more questions on that, which can be asked in theory in the form of short.
Thank you. There's another question. Kindly suggest the central skills lab topics for biochemistry.
Yeah, for biochemistry as such, if we talk of skills, it is always the practical skills, the experiments which we do. So not much of work is done on this, but we can have some skills which are must for the students. We can identify such skills which are must for the students. Maybe some estimation part may be important as like a part of urine report in the form of OSPE. So that can be made, like measuring the specific gravity again. So it is the psychomotor skills which we can have in it, not the soft skills. For soft skills, there is another soft skill lab which is advised by the MCI for every medical college, the communication, the CAP lab, communication, attitudes, and phonetics lab by the MCI. But we as a biochemist will be more focusing on the psychomotor skills.
Thank you. And Dr. Anupama Patni wants to know how to actually conduct a SDL, self-directed learning.
Now, this is a very, very difficult question for me too. Self-directed learning, what I understand, but again, there may be different views on that. What I understand is where teacher shows just the path, means just gives the clue, and ask the learner to search for the references, search for the material, and learn by his own.
Can you give us a specific example, a specific topic, Dr. Anita, that would kind of tie it in together?
Yes, maybe like for example, now early clinical exposure is also there. Suppose we are dealing with a diabetic patient, or we are dealing with the topic of carbohydrate metabolism, and we teach the students during the practical. We show them the clinical case before doing estimation of blood glucose. In that, on the first day, we can give them the case scenario. We can tell them to identify the difficult words, like there are some terminologies, medical terminologies, which are not understood right in the first MBBS in the beginning. So instead of just opening everything in front of them, we can tell them to go back, discuss, search for the references, learn amongst them, discuss amongst themselves, prepare the notes, and come next day. And then this is what Dr. Rafi can put more light on this.
Please, sir. Yes, Dr. Rafi, any?
This SDL is self-directed learning. You are advised to allot non-core topics to the student. Unfortunately, there is only one non-core topic.
Only one.
Biochemistry. So certain the desirable topics, not the core components, course syllabus. So such topics can be allotted to the student, and he can be encouraged to search for a relevant material and come on his own and make a presentation before the whole class or in a small group. So that can always be just corrected or helped or suggested or improved by the respective teachers. Because no topic can be learned 100% through SDL. So that is for sure. But definitely that improves their communication skills, their presentation skills, that encourages them to search for the multiple sources. And yes, definitely that makes them, that generates some interest also in the subject, because when they themselves are supposed to present certain topic on their own, so I think that paves way for make them some interest in some future research or kind of.
Okay, I suppose we have time for one more question. Dr. Rafi, how would you plan to carry out the integration part of biochemistry with other subjects? Would you be getting in faculty to teach those integrations, vertical and horizontal? Is that how the lesson plan will work to carry it out?
Question. In fact, one of the professors was just asking about the alignments.
Alignments, yes. How do you deliver what is required from the other subjects?
Yes, Dr. Anita, would you like to?
Yes, I would like to comment here. alignment means, how alignment is different from integration. Alignment means like when anatomy, alignment is amongst the same phase. So you should keep in mind, alignment never goes into second or third phase. So if I want to align my topics, I will have to align with physiology and anatomy. Suppose anatomy is doing the dissection of abdomen, liver dissection. So at the same time, physiology can have liver functions and we can have liver function test. During the same period, with maybe a fortnight, 15 days, during the same period, the teaching learning activities are conducted by the three subjects. This is alignment. Integration can be vertical, like Salgar sir has very well said. It can be with the second phase or third phase, or it can be horizontal also. I'll give one example. Again, that MC has given three types of integrations, like sharing, correlation, and nesting. Nesting is like we all do. Like I am teaching topic of blood glucose regulation. I will definitely talk about some clinical components, some like diabetes mellitus. I'll touch little bit of medicine during my lecture. But we have to keep in mind, my main objective is to teach biochemistry, but little part of it, maybe 5 minutes, 2 minutes, I can touch other subjects, maybe pathology and maybe medicine. So this is nesting. Our whole big topic is nested with small component of other subject. Another is sharing, where we actually we sit before the teaching learning activities. We sit with different teachers, like I may sit with pathology, physiology, and we discuss amongst ourselves that which are the common objectives. Like, I'll give one example which has happened recently in CBME. They have removed hormones from biochemistry and they have given it completely to the physiology, while the molecular biology has been removed from the physiology and they have given it to biochemistry. So they have decided this topic will be taught by them. Similarly, some objectives are always overlapping amongst us and physiology or with pathology. So we sit so that there will be no overlapping, and we sit and we decide which objective will be conducted by which. And the third type is correlation, which will have to, different single topic is there may be thyroid, and we will see that which all departments we can involve. We can involve medicine, we can involve surgery, we can involve physiology, and it depends. Either you can take it or you can call the person from another phase.
Thank you ever so much. It was so interesting to listen to all your lucid answers to questions. There are a couple of more, but we'll have to take them on a personal basis. And perhaps if you could leave your email, I'm sure the panelists would be happy to get back to you. I now hand over this to Malik, my colleague. Yes, Dr. Rafi.
Interesting question from a professor here. He's of the opinion that, as far as, of course, the integration is okay, like we need to do. As far as the alignment is concerned, so he's asking, like, every subject has its own flow, its own sequence of, the subject has to be understood as a whole, as a holistic approach. When there is a alignment is forced upon, so we are losing that stream of, that natural flow of a subject, and you are forced to align with the other two subjects, which is making it completely artificial and making the whole process very uninteresting and breaking the subject into unwanted pieces. So that is one valuable opinion from a learned senior professor on this alignment. I think so. My answer to this question is a wonderful question, sir. Even yes, I do agree to some extent with you. Same way, yes, you have the liberty at the institute level. All the HODs and the faculty of the three departments have the liberty of making some certain innovative changes in those alignments. And definitely, there is no question of making the sessions boring or uninteresting or difficult for the faculty. We need to make all the checks and balances, because alignment is definitely, it has got its own advantages, and everything has got its disadvantage aspect also to it. Right? So we need to balance. And make it more interesting, taking into consideration all the aspects of it.
So align it as far as possible. As far as possible, it is not compulsory. And what will you do? What will you do in part 1, third MBBS part 1? ENT, ophthalm, and community medicine cannot be aligned. So it is not necessary that everything has to be aligned and it is must. No, as far as possible.
Panelists, I really have to, I'm sorry, I have to interrupt you here. I'm sure there are plenty of challenges in the teaching of biochemistry as in all subjects. We are running out of time and I have to stop all of you, and thank you very much. I will now hand over to my colleague Malini, who will deliver the vote of thanks. Malini.
Thank you, Dr. Sudha. A very good evening to our respected panelists, valued attendees, and my dear colleagues. I'm Malini Gopalakrishnan, Assistant Editor, Universities Press, and it is my privilege today to conclude this session. On behalf of Universities Press, I would like to extend my gratitude to our esteemed panelists, Dr. Rafi MD, Dr. Anita Chalak, and Dr. Somnath Salkar, for taking time out of their busy schedules to come together to conduct today's workshop. Thank you, panelists, for your time and your expert insights and guidance. I would also like to thank the members of the audience who made time to attend today's session. We sincerely hope that you all found this webinar informative and interesting, and that it answered some of the questions you might have had on the CBME guidelines and the teaching of biochemistry. Finally, a big thank you to the management team and my colleagues at Universities Press and Orient Black Swan, without whose efforts this evening's events would not have been possible. Once again, a very good evening to everybody.
Shall we leave?
Yes, ma'am.